It's one thing to talk about how deadly fentanyl is, but it's another thing to actually see someone dying from it. It's what firefighters and paramedics say they have to deal with every single day. And though they're armed with a powerful overdose antidote, a drug called Narcan, as you'll see, they're barely able to keep up. Natalie Clancy takes us to the front line, and a warning for you, this report may not be suitable for all viewers.
We had 6 overdoses since 6 a.m. this morning.
It's another crazy day for Jason Lynch's crew from No. 2 Fire Hall. In the heart of Vancouver's downtown east side, they work out of Canada's busiest fire station. Though they hardly ever put out fires, these days they mostly save lives.
Hi, how are you? Good, Dr. Sutherland. You guys seem like you have a handle on this whole situation.
More often than not, the patient has already had a first shot of naloxone by the time they arrive. It's what first responders call Narcan, and it's the antidote to opioids like heroin or fentanyl. A local doctor was already working to revive this addict. Nurses ask us to back away and protect the privacy of their patient.
Hey!
Within minutes, he's back. When Narcan works, that is a good call. Sometimes it doesn't in a province where a state of emergency has been declared because 2 people are dying every day.
It's very difficult, to see humans in that kind of trauma and, in that kind of situation. You're walking into an alley that obviously has a lot of different smells going on in it, a lot of rats, there's needles, there's garbage everywhere, and you just walk by lines of different people shooting up, and then, you treat the third one on the left, and then it's just a matter of time before the first 2 go down as well.
This is an especially busy day because it's when people line up to get their monthly welfare checks. Welcome to Welfare Wednesday in Vancouver. All that cash on the streets mean fentanyl dealers are busy and first responders are in high demand.
Do you want to go to the hospital and get checked out?
What the hell is the news crew doing here?
Hey, out, man. Out. Hey, come on. Out.
And their next patient was already revived by a neighbor in a tent city.
Can you guys get out of there so we can get in there?
Down here, naloxone kits are free to any addict who wants one.
Are you guys out of Narcan down here? You gave her 4 shots of Narcan?
She's oblivious to her soiled shorts, the blood dripping down her leg, and the thick smell of human waste.
Yeah, she definitely get checked out.
They're trying to convince her she needs to go to hospital before the Narcan wears off and she passes out again.
So you don't have a choice. You're just going to OD as soon as it wears off?
We just want to take you to the hospital and get checked out if that's okay.
They have been here many times. Some are repeat customers.
I personally Narcan the same 24-year-old girl twice in the last month, and it definitely it wears on you. It wears on your soul and on the conscience, just looking at the same person over and over again, doing the same things, and we're putting a small Band-Aid on a big cut.
She cooperates, but their next patient will be more challenging.
2 doses of Narcan. Let's get him on his back. You want to get an OPA in, Connie?
After 2 doses of Narcan, he is still not moving.
Do you want us to bag him?
Just 1 second. You guys are like the pros now.
We are.
And he did get 2 doses.
Nothing is working. The paramedic decides to try something new, the nasal version of naloxone.
Pick a nostril.
Oh, there we go.
EOD. EOD, buddy.
You pick a nostril and then they wake up?
It worked, but not on their next call, which takes them inside a shelter where a man happened to be walking by after using a new, stronger batch of fentanyl. Staff asked us to stay outside while they get to work.
Pulse is 100. Got more Narcan?
So we walked in and the patient was barely breathing and his oxygen saturation was down to 60%, and he had taken some fentanyl and he was told it was stronger fentanyl and a lot of people were overdosing.
But this patient was not responding to Narcan or painful stimulation.
So the basic ones are a sternal rub, a knuckle in the rib cage, a trap squeeze, or rubbing the pen on the outside of the nail. All of them are extremely painful, and I think we were doing 3 of them to the guy at once for about a 5 to 10 minute period, and he didn't even move.
Finally, he grunts back to life.
Oh, we got that.
There it is.
What's up? You overdosed. You gotta stay up. Stay awake. Keep those eyes open.
I'm not joking. You took a ton of Narcan.
Luckily, say firefighters, staff here are trained to administer a first life-saving dose of Narcan right away. They do it all the time.
We've had about 240 different interventions in 2016 in terms of naloxone alone, and each one of those are life-saving interventions that our staff have quite bravely been a part of. And you know, it can be very daunting to administer a needle to somebody if you're not a health-trained professional.
We had to administer 3 separate rounds of Narcan, which is a total of 0.12 Narcan, and we were bagging him for probably about 10 minutes before he came out of it.
So he nearly died.
Close, yeah.
The difference between life or death in an overdose comes down to minutes.
So luckily he felt he was going down, so he walked in to look out here, one of the clinics downtown, and they were able to administer the first dose of Narcan.
Workers at shelters and clinics down here are the unsung heroes in the fight against fentanyl deaths. Now that naloxone is available without a prescription, anyone can use it. So workers and other drug users themselves have saved hundreds by giving the first shot before the paramedics and firefighters even arrive.
I've got people on the front line here that have done 20 plus, and you know, those are Narcan warriors that have just continued to keep people alive long enough in the hopes that they're going to make better choices in the future.
This is our 10th time doing it today, so it's a daily routine for us.
Natalie Clancy, CBC News, Vancouver.
Now, it was back in July, Premier Christy Clark announced the creation of a task force that would be headed by the provincial health officer, Dr. Perry Kendall. The mission of that task force, to come up with a plan to bolster overdose response and prevention. And one of the members of that task force joining us right now, Dr. Evan Wood. You're also the medical director for addiction services with Vancouver Coastal Health. You think of the number of people who are dying every day, 2 people per day, according to the BC Coroner Report, to drug overdoses. Where does your work intersect with that number? What is it that you hope to accomplish?
So, yeah, just as a member of one of the sub-task groups of this overall effort that's focused on addiction treatment, and it's really to try and look at the investment in the healthcare system for mental health and substance use. About $1.3 billion per year is spent by the Ministry of Health and health authorities in terms of responding to the problem of addiction, and how can we improve that system of care in the context of the overdose epidemic.
So how can you improve it? And in fairness to you, I mean, you've only been part of the task force for a little over a month.
Yeah.
But what concretely do you hope will come of it? What is it that you're going to propose?
Yeah, so we're lucky in that the provincial government has shown a fair amount of leadership in terms of improving the system of care in the run-up to this. So a number of things in terms of improving access to medications, supporting the development of therapeutic guidelines and other initiatives. For now, it's really about implementation. So just to give you one example, one area of focus is that medical detox programs. We think of interventions for people with addiction. They need detox. When it comes to opioid addiction, offering medical detoxification as an isolated intervention, because people's tolerance is reduced in those programs, they can be more vulnerable for addiction. So looking at detox programs and ensuring that it links people to recovery-oriented systems of care or other systems of care if they're going into a detox. Other efforts involve the development and sort of championing throughout all the health authorities in the province a guideline for the treatment of opioid addiction.
How much more funding would you need in order to pull off some of the things that you're talking about?
Well, you know, we have investments in the healthcare system for things like medical detox programs where we can probably save money in terms of having people treated as outpatients and other things. So as someone who does a lot of advocacy on behalf of people with addiction and has to meet with families for people that are struggling addiction, certainly I think more resources are needed.
Yeah, because you're also talking about more coordination and more services in the back end, right?
Right. So that's certainly needed. In terms of the funding for this type of effort, as just a member of the committee, that's kind of above my pay grade, but certainly there are efficiencies and opportunities with the funding that's available to do more.
But given the scope of the crisis, can you actually tackle it in a meaningful way if there is no significant change in how much the provincial government is willing to put in?
Well, you know, within all the health authorities in the province, there are functioning mental health and substance use committees. There are training programs to try and roll these types of things out. So I think it's looking at the investment and looking where need for new money exists and ensuring that we spend that money appropriately and prioritize things. And that's really the work of the task group, is to look at where are we weak, where are the gaps, how can we address those gaps, either with existing structures or through the development of other structures that may require investment.
Last question for you. How optimistic are you that the work of your task group the provincial government, everyone who's on the front lines, that we can put a dent in this, and soon?
Yeah. You know, this has really been a neglected disease for so long because of the stigma towards people with addiction and the criminalization of this problem in our society. I'm extremely optimistic that things can be dramatically improved, but fentanyl, due to its potency and how dangerous it is in terms of its illicit use, you know, I think there's huge challenges ahead as well.
Okay, Dr. Wood, we'll leave it there. Thanks for joining us.
Thank you so much.